Welcome to the Preterm Birth Education Program at Kaiser Permanente.
What is preterm labor?
A full-term pregnancy lasts approximately 40 weeks. Preterm labor is labor that starts before 37 weeks with cervical opening or thinning and usually results in preterm delivery of the baby. Preterm delivery occurs in about 1 in every 9 infants born in the U.S. It has been shown that if a pregnancy can be maintained for at least 37 weeks, the chances of the baby experiencing problems and complications with breathing, eating, or maintaining his or her own body temperature are reduced. Babies who are born before 34 weeks will require intensive care in the hospital after they are born and are at an increased risk for long-term problems and disabilities. Therefore, it is important for all pregnant women to be aware of the signs and symptoms of preterm labor. There are currently no known methods to stop preterm labor once it is started, but if preterm labor is identified early enough, interventions can be taken to delay delivery and improve the baby's health.
What are the signs of preterm labor?
The following are warning signs of preterm labor. You can have one or more of these signs at the same time. A dull, low backache. This backache is below the waist and may come and go or be constant. Menstrual-like cramping. This occurs in the lower abdomen just above the pubic bone. It may come and go in a regular pattern or be constant. Pressure and pain in the lower abdomen, pelvis, or thighs. You may feel as though the baby is pushing down. A change in your vaginal discharge. Vaginal discharge may increase or change into a heavy, mucus-like, watery, or light bloody discharge. Intestinal cramping with or without diarrhea. Uterine contractions that are more than 4 to 6 per hour and last longer than 35 seconds, even if they are painless, and just not feeling well.
What is a contraction?
A contraction happens when the muscles of the uterus tighten. It is normal to have some contractions during your pregnancy, but if they occur frequently, it might be a sign of preterm labor. Frequent contractions can cause a change in your cervix. This tightening may be painful or painless, but if it lasts 35 seconds or longer, it is counted as a contraction.
How do you count contractions?
To count contractions, drink a glass of water or other fluid. Empty your bladder. Lie down in a comfortable position on your side. If you need to lie flatter, place a pillow under one hip in order to maintain a good blood supply to you and your baby. Place your hand on your abdomen over your uterus with your middle finger over your navel and spread your other fingers apart. A contraction may feel as though the baby is getting into a ball or pushing up against your fingers or slowly rolling over. Your entire uterus will feel tight if you press with your fingers. Any tightening lasting more than 35 seconds is a contraction. Count contractions for a full hour.
What do you do if you have signs of preterm labor?
If you have signs or symptoms of preterm labor, you may try the following. Empty your bladder and continue to urinate frequently. Drink 1 to 2 glasses of fluid. Lie down on your left or right side and count your contractions for 1 hour. Please call your local labor and delivery or preterm birth education program if you continue to experience any sign or symptom after 1 hour, or count over 4 contractions an hour, or count over 6 contractions an hour for twins. If you have bright red bleeding or are leaking fluid from your vagina, please call your local labor and delivery or preterm birth education program immediately for further instruction. Do not wait.
What happens if your water breaks before 37 weeks?
If you're leaking fluid or have a gush of fluid from your vagina, the amniotic sac or bag of water around the baby may have ruptured or broken. This is called premature rupture of membranes. If you think your water has broken, please contact your local labor and delivery or preterm birth education program immediately.
Are there any medications for preterm labor?
Currently, there are no known methods for preventing preterm labor once it has begun or the membranes have ruptured prematurely. Some medications called tocolytics can be used for a short time to delay birth long enough so that steroids can be administered to the mother before the birth of the baby. Steroids administered to the mother before a preterm birth can help decrease breathing problems and other difficulties in the preterm baby. A temporary delay in birth can also allow the pregnant mother to be transferred to a hospital with specialty care for premature babies.
Who's at risk for preterm labor?
Most preterm births occur in women without any risk factors, so preterm labor can happen in any pregnancy. However, some women are at an increased risk. If you have an increased risk for preterm labor, your provider will discuss this with you and refer you to the preterm birth education program. Some of these risks include preterm delivery with your last pregnancy, pregnant with twins, physical problems with your cervix or uterus. Having a risk for preterm labor does not mean it is likely you will deliver your baby early. However, it is important to be aware of the early warning signs and pay attention to your body.
What is the preterm birth education program?
If you are at risk for preterm labor, you may be qualified to enroll in the preterm birth education program. Most women at a high risk for preterm labor will start the program at approximately 24 weeks of pregnancy. You will stay in the program until you are 36 weeks pregnant. You are expected to lie down daily for 1 hour and check or palpate for contractions. Familiarize yourself with the signs and symptoms of preterm labor. Call to report if you have any signs and symptoms of preterm labor. A registered nurse will call you on the telephone once a week to monitor your progress. A nurse is available 24 hours a day for those enrolled in the program. At 36 weeks, you will be discharged from the service. You will be instructed to contact your local labor and delivery regarding any signs and symptoms of labor. If you have signs and symptoms of preterm labor, you may need to go to your local labor and delivery to be evaluated.
Are there any activity limitations while I'm in the preterm birth education program?
There is no evidence that bed rest or activity restriction delays preterm labor. But you should discuss any activity restrictions with your provider and follow the advice given.
What are kick counts and why should you do them?
Kick counts are an easy way to check the health of your baby. They should be started at 28 weeks of pregnancy and are done daily at the time you feel the baby is active. Any movements other than baby's hiccups are counted. Once the baby has moved 10 times, please look at the time to see how long it took to feel 10 baby movements. It is important to do kick counts every day until your baby is born. Please call labor and delivery right away if your baby has not moved 10 times within 2 hours. Thank you for watching this video. On behalf of all of us here at the Perinatal Service Center, best wishes for you and your baby.